Luis, you want to test your audio again?
All right, so we're at 2 o'clock. We cannot test. We're past class time. Sorry.
Thank you. Sorry.
Good afternoon, everyone. Well, Friday was a good day as we began vaccinations at our nursing homes here in Ohio. Fran and I were able to visit 2 of the nursing homes when this was being done. We were outside, but able to talk with some of the staff and watch that occurring. We also were in Sandusky at the Veterans Home, and John Husted was in Georgetown at the Veterans Home there. So it was a good day across the state of Ohio. We're continuing to see vaccinations in our nursing homes today. In fact, we're going to go to one right now. We're going to go to Bethany Village, which is in Centerville. And there you guys are. Jess, how are you?
I'm good. How are you?
Jess, I'm good. I'm good. So tell us what your job is there.
I am actually one of the long-term care nurse managers, but I also serve as the facility's infection preventionist. So I do a lot of extra, extra work this time.
A big job.
Absolutely.
A big job. So you all started vaccinations this morning, did you, or when did you start?
CVS got here around 10 a.m. and we started rolling out on the units around 11. So go ahead. I'm sorry.
How do people feel about that? How do the residents feel about it? How do you feel about it?
I'm excited. Our residents they've been very receptive, very excited. Families were over the moon excited that we were going to be getting them this early. So it was pretty easy getting consents last week for everyone. Most of them questioned why we were even asking just because they were so excited. But I'm excited.
No, that's great. That's great. Carol, how are you today?
I'm fine, thank you.
And how do you feel about how do you feel about this?
I'm ready and anxious. I think it's been a wonderful thing. I'm very pleased to be part of it. And I think it's going to be a great thing here in the future.
Okay, ready and anxious. We won't hold you back anymore. We'll let you guys go ahead and do it. We'll watch.
I'm going to have to take your arm out. Yep, you're good. You can move.
That didn't take long.
Thank you. You're good to go. Hardly felt a thing.
That's great. Well, thank you very much. And thanks for letting us watch. And we hope you have a great day and everybody else has a great day. We're happy that this day is here. Thanks a lot. Thank you. I appreciate it. So we're now headed up northeast Ohio, Andover Village, Ashtabula. So long way from the Centerville area. So it is great. Rachel, how are you?
I'm good, thank you. How are you?
How's today been going?
It was really great to be here today. We had a very smooth first day. The facility was great for us to be here.
Finish watching the press conference.
And what time did you all start?
We arrived about 9 a.m. and we started vaccinating right around 10.
So this facility is being done by Walgreen, correct? You work for Walgreen?
Correct, yes, I do.
It's good. And so things so far so good?
Yeah, it's been really great. I'm just very excited to be part of this.
Well, that is great. Brenda, how are you?
I'm fine, thank you.
How do you feel about all this? You ready to go?
I'm ready to go. I've been ready to go. Faster we get, maybe faster we can get some people in here and see it.
I think a lot of people are ready to get this done. So
Yeah.
we're excited about it. So why don't you guys go ahead? We'll just watch you then.
Okay, great. Ready? Perfect. Welcome. There you go.
All right. How'd that work out, Brenda?
Oh, it was wonderful. I really didn't feel the need to go in.
That's great.
Good.
Well, we wish you a good day, and we're happy this day has come, that we're getting started, and we want to keep going all through our nursing homes. So thank you very, very much, and
You're
Merry
welcome.
Christmas to you, and thank you for doing it.
All right, Merry Christmas.
Thank you. Thank you very much. Throughout the pandemic, the National Guard has been supporting Ohioans by working in food banks, filling in for staff shortages at some of our nursing facilities, working in our prisons, conducting pop-up COVID-19 testing across the state of Ohio. And virtually every day, the Guard is in one or two locations doing the testing. This weekend, we heard from the U.S. Department of Health and Human Services that the National Guard has received a waiver that allows them to help in the administration of COVID-19 vaccine. So we're joined today by Adjutant General John Harris of the Ohio National Guard. General, thank you so much for joining us. And if you could just talk a little bit about what the Guard has been doing during the pandemic. And, we have not made any decision yet in regard to the deployment of the Guard as far as the vaccinations, but you and I have talked about it, and I know that, there will certainly be opportunities in places where we'll want the Guard to come in and get the job done. So thanks for joining us.
Thank you, Governor. I'm currently located today at the Ohio National Guard's Medical Detachment. That unit's located on the Defense Supply Center, Columbus, one of our major federal military installations here in the state. And this unit is responsible for the readiness of the Ohio National Guard, the medical readiness, the psychological readiness. This unit here is comprised of physicians, nurses, medics, physician's assistants, nurse practitioners, dentists, dental assistants, even some behavioral science officers. And their primary responsibility, as I said, is the readiness of the Ohio National Guard to respond here for the state of Ohio. Most of the people in this unit are civilians. For the most part, there are a few full-timers here, but just about everybody here is traditional guardsmen. So that keeps them on the leading edge of the current techniques, current procedures, and current technology in whatever their selected craft is. Additionally, most of the people assigned to this organization have significant deployment experience. So that brings another dimension of broadening and decision-making and experience for our medical professionals here. In addition to this unit, we have 4 similar organizations that are assigned to our air bases around the state that bring that same capacity to our Air National Guard. So altogether, those folks take care of about 16,000 soldiers and airmen across the state. So as you said, Governor, the great news is that HHS has authorized us to bring that capacity to bear to help vaccinate the people here in Ohio. And that's pretty significant because generally our medical providers don't provide medical treatment directly to the population. But this is significant because not only does it give us more flexibility as we figure out how to get the population vaccinated, but it helps us reach some of those hard to reach areas of the state, some of the hard to reach populations that may otherwise have difficulty getting the vaccine. I will tell you, we're going to be prudent in how we bring these professionals onto duty. One of the things that we don't want to do is as we take these folks from their civilian jobs, we don't want to degrade the capacity of the healthcare system that's already strained in the midst of this coronavirus. So we're very prudent in how we select the providers that we're going to bring onto duty, the medics that we bring onto duty, the paramedics that we bring onto duty, so we ensure that we don't harm those institutions that they work for in their civilian jobs. The other piece of good news that we have, Governor, is that we have some vaccine inbound for our own soldiers and airmen. So those people who are out there on the front lines in this COVID response, as you mentioned, going into nursing homes, in some cases going into correctional facilities, providing support at the food banks. Now we can ensure that those people aren't vectors for the disease. We're protecting them so they're not carrying the disease from facility or mission set to mission set, but also it allows us to protect them as they go into those high-risk environments and their families to ensure that we're not contributing to the community spread of the disease. So, Governor, I couldn't be more proud of these soldiers and airmen and the work that they're doing. And we stand ready to live the Guard Creed, which is always ready and always there. So thank you, sir.
Well, we thank you and the men and women of the Ohio National Guard. You've done so much during this pandemic, and anytime we've called upon you, you've done it. And I think, you know, your point, General, about what the Guard has done in regard to testing, that you have gone places that were underserved. You've gone places, frankly, where people asked for you to come in, where they felt that you were needed. And I suspect that is what we're going to see in regard to vaccinations. It's going to be very similar to that we're going to ask you to go to, you know, places where they're being underserved for whatever reason. And when we get to a much broader general population, you know, it's going to be very, very important that we vaccinate at a high rate, carefully, obviously, but do it. And the National Guard is going to certainly play a big role in that as we move forward. So thank you very much. And you're waiting for your vaccine today, right?
Yes, sir. It's inbound. We expect it in the next 12 to 24 hours.
Okay. Good luck. Thanks, General. We
Thanks, sir.
appreciate it. Eric, let's go to our data for today. We report today 6,548 new cases. Sadly, we had 75 deaths reported in the last 24 hours. This past Saturday, we went over 8,000 deaths of our fellow Ohioans since the beginning of the pandemic. In addition, we have 301 new hospitalizations, and we have 37 new ICU admissions reported in the last 24 hours. Again, you know, it's best to look at the kind of the long term. Some days are up, some days are different. Sometimes Mondays are less, but that's what they are today. Eric, let's quickly go to the top. Ohio, 88 counties ranked by highest occurrence. We currently now have 17 counties with a case rate over 1,000, meaning that at least 1% of the people in these counties have been tested positive for the virus within the last 14 days. So all of these counties are at a very high level. Some are much higher than others. If you go to the bottom of the list, you will see only four counties though, with a case rate below 500. So every county except 4 is at least 5 times higher than the CDC definition for high incidence. I will take a quick look at the top 20 counties. These are highest incidence, starting with Wyandotte, Brown, Jefferson, Harrison, Richland. And you can see we really have a geographical spread now of these counties. But if you look, for example, at Wyandotte County, it's at over 14 times the high level of positivity. So we're seeing really, you know, very, very significant spread continues throughout Ohio. Before Thanksgiving, we were very concerned about a potential surge in cases. Thankfully, we have not seen cases go up dramatically. This map comes from the New York Times. It shows data that gives us an idea of what happened over Thanksgiving period as far as the movement of people. The number of contacts Ohioans had over the holiday was reduced. And let me explain quickly how you look at this map. And this is comparing it to a year ago, what Thanksgiving looked like. And if you look here, this is a map that's kind of reversed of what we sometimes look at. no contacts are the blue. In other words, the fewer contacts of individuals are the blue, and then it goes across here. And here, these counties would be the same as 2019. And so what this measures is public data, but what it measures is how close you are to other people and how many people you're in close proximity to. So it's different than the ODOT travel data. This one is probably more precise as far as to what we're trying to measure, which is how much did people hold back. So, we're happy with what we saw here. Again, to explain it, these counties here, basically same as in 2019. What we want to do, obviously, is have fewer contacts. So the darker it gets, the fewer contacts there are. So overall, I think we should be pleased with what Ohioans did over that Thanksgiving weekend, or Thanksgiving and Friday afterwards, and then the Saturday and the Sunday. And of course, what we hope is that we're going to see, people pull back and be very, very careful, fewer contacts over Christmas. And which we know it's, it's a longer period of time. Some people, like in our family, we've historically celebrated on Christmas Eve. So some people start on Christmas Eve and then, of course, go through New Year's. So it's a longer period of time. And, we're just asking Ohioans to one more time step up as the vaccines have started coming in. And there's great hope. We also know we've got to continue to stay focused on keeping this spread down. Let me go to Dr. Vanderhoff, who's joining us now. And Doctor, maybe you want to comment a little bit on that map and talk to us a little bit about what you see coming up, and just kind of where we are in Ohio as far as the spread.
Thank you, Governor. Well, as you indicated, when we look at that map, we can see that up to and through Thanksgiving, we Ohioans really took important steps to keep our high rates of COVID-19 from climbing even higher, and thus overwhelming our hospitals. But in spite of this, our hospitals remain extremely busy with COVID-19. Adding a post-holiday spike to that would create a terrible situation, not unlike what we're hearing about in some other parts of the country. So what's important to remember is that the actions that we are taking right now will show up in weeks, so after New Year's. So we can't let ourselves be lulled into a sense of complacency as we move into this next 2-week period. So as we head into this, which is the biggest holiday on our calendar, let's remember a few key points. And this is part of our recommendations for staying safe in Ohio. Number one, we should stay home as much as possible. Home is the safest place. We need to wear our masks whenever we're around others from outside our household. And it's especially important to make sure that the mask covers your nose as well as your mouth. Keep your distance and keep it short. Remember that the more people you're around and the longer you're together, the higher your risk of sharing COVID-19. Wash your hands. Remember, your mother was right. Work from home whenever you can and keep all your meetings virtual. Keep celebrations this holiday season safe and small. Remember especially that the older members of our family are especially vulnerable to COVID-19. So we need to take special measures, extra measures to protect them. Don't eat or drink with people outside your household. Eating and drinking with others is especially risky because that's a time where, by definition, we can't wear our masks. Rethink those travel plans. This is a holiday to stay close to home and enjoy safe holiday activities like drive-through light shows or visiting via phone calls or video chats. Remember, this virus, it spreads from me to you through the air as we breathe and talk. It spreads even when we don't have symptoms. So let's work hard this holiday to keep each other safe, even as we are looking forward to all of us getting vaccinated.
Doctor, thank you very much. I'm going to ask Eric, Doctor, to put up the slide with the protocol that I know you were just talking about. And this actually is a newspaper ad that's going to start showing up in newspapers. This is the protocols that we talked about the other day, but it also has the 4 nurses who appeared in the TV ad. It says, here's how you can help save lives. And before that, it says, we need your help. I think it was summarized pretty well as far as what happened over Thanksgiving this way. This was an epidemiologist quote by the New York Times, said it well. The fact is, people took precautions, and those have helped to not make things worse. Not enough to make things better, but enough to not make things worse. And I think that's probably a pretty good description of exactly what happened. And we gotta hang in there over Christmas and New Year's. Every Monday morning, I'm on a call with over 100 health departments around the state of Ohio. These are the local health departments who are doing the work. They've just started today to get some of the vaccine in, so they'll be vaccinating our EMS responders and others. So they've got a lot going on. And of course, one of the things we've asked them to do throughout this, and they've done a very good job, is contact tracing. But one of the issues that they raised today had to do with lack of information sometimes that is coming through from the healthcare provider who is doing the testing. So I'd like to take a moment to remind our doctors and others running testing to please be sure to collect complete information, including telephone numbers. This is vital information, so local health departments are able to follow up for case investigation and contact tracing. So we certainly appreciate that very much. Let me now turn it over to the Lieutenant Governor.
Thanks, Governor. I know that it was exciting news when we were at the nursing homes and veterans homes on Friday, and you can just feel the excitement when we're at those facilities. So it was great to see so many of them getting started with the vaccine today again. I have 2 things I want to focus on. I know that many of you noticed on the economic front that on Friday we had a 5.7% unemployment rate, and we gained 29,400 jobs, which is good news. That marks the lowest unemployment rate we've had since February, which is more good news. But I think we all know that doesn't tell the whole story of what's going on for people out there right now. That there are still over 300,000 people that were working prior to this that are not working for a variety of reasons, that they've chosen not to because of the virus or haven't been able to because of complications with the virus. Or perhaps they're not trained for the jobs that are being created in the post-COVID world. This is a reminder to folks, because this is a time where a lot of people want to think about a fresh start in the new year. There are 169,000 jobs available that are posted on OhioMeansJobs.com. Nearly 90,000 of them pay $50,000 a year or more. But many of those higher paying jobs require some type of additional training or an industry credential. And many of those credentials can be earned in weeks. And we have a great way for you to do that. I want to just emphasize that there are resources for you out there to get the training that you need. One of them is through our individual micro-credential assistance program. This is targeted at a lot of tech-focused credentials, which is what employers are demanding. And don't think that you can't do this. You can. The training programs are so wonderful for these that if you have any kind of interest in it, they can train you for a variety of jobs. This program has no cost to the individual participating. There are 11 training providers for 54 eligible credentials. This is an important part in the COVID world. 37 credentials can be completed 100% online. So you don't have to go anywhere to get this training. And so please take advantage of this opportunity because you can get this done in weeks. You should visit, if you're interested, IMAP, that's imap.development.ohio.gov, to apply. So check that out for maybe if it's not for you, maybe it's a child, a grandson, a granddaughter. We can help them get 2021 started off in a better light. And then along those lines, we know that we keep working on that digital divide. We announced the project, the test project with Starlink, which can maybe help us hit the most remote parts of Ohio with high-speed internet service, and we're testing that. But we also know that we need training and people with digital devices that are really capable of doing a lot of the work, doing a lot of things that people need. And the state of Ohio donated 148 computers to PCs for People last week. We were joined with DAS Director Dan Schroeder and the Executive Director Brian Mock from PCs for People. They're just one resource where you can, if you're a business, you can donate your dated or excess PCs, something that may not be top of the line for your business, but would be perfect for home use, for students and other things out there. And so we encourage you to reach out to either PCs for People or other local not-for-profits that are helping get these computers reconditioned and prepared for distribution for families and students all across this state. So just some thoughts as we enter the end of the year here. We're talking about training, we're talking about digital divide, we're talking about ways that people can help. This is just one of them. So Governor, back to you.
Thank you very much. We're ready for questions.
Governor, first question today is from Adrian Robbins at WCMH in Columbus.
Hi, Governor. Thank you so much for doing this today. Some states are pushing back on sharing information with the federal government. Has Ohio signed the CDC's data use agreement? And if so, how much information, especially identifying information, are you comfortable sharing with the federal government when it comes to the people who are being vaccinated and eventually when the general public is vaccinated in Ohio as well?
Yeah, I don't know the answer to the question. Bruce, do you know?
No, Governor, I do not.
We'll get that for you. Thank you.
Next question is from Aaron Portzline at The Athletic.
Good afternoon, Governor. I'm not sure what levels of communication you've had with the Blue Jackets or with the National Hockey League. They have announced plans to start their season in January. No fans at this point in Nationwide Arena, but I wonder your thoughts on them resuming play in indoor arena, obviously, and your thoughts, whether you're optimistic at all that by the end of their regular season, likely in May, that there could be the potential to have some fans in Nationwide Arena.
Yeah, that's, that starts with the local health department. The application would go from there, and then it would go to us. So I'm not going to, make any real definitive comments about that. We want our health department to take a look at that. The challenge, of course, is inside, and many professional sports have very, very good ventilation. Which is something that many times you cannot find in smaller gyms. You cannot find maybe in high school gyms. So we'll have to weigh everything. As far as where we're going to be by May, we hope we're going to be a lot better. We think we're going to have a tough time for the next few months. The vaccine obviously is not going to really affect a large number of people for a while. And of course, the further on we go, more people are vaccinated. That obviously is a good thing. We also hope that, when we get out of winter and we get into warmer weather, that things begin to get better as well. So we are hopeful. If you're asking me, are we better off in January or May? I certainly hope we're going to be a lot better off in May. But we really don't know. The one thing we found about this pandemic, this virus, is it keeps teaching us things, unfortunately, and we keep seeing different things. So one would think it would get better as we go on, and we'll take a look at their application.
Governor, I could add, I'm not sure, just so we can let Aaron know the process, they would have to seek a variance from the state of Ohio. And to this point, I'm not aware that they have sought that variance yet. So we'll wait to talk with them.
Next question is from Farnoosh Amiri at the Associated Press.
Hi, Governor. I have some questions about the vaccine. You mentioned last week that there's going to be an addition to the state's data that's going to show how many people have been vaccinated in Ohio. Wanted to get an update on that, if that's up and ready. And then the other thing is about the supply. We obviously found out late last week that we got less doses of the Pfizer vaccine than you had initially been told by the federal government. Does that concern you moving forward into other phases?
Well, it doesn't, it does not concern me. We're going to move whatever they give us, and they're going to tell us once a week, and then we're going to know what we can order, and our goal will be to get as much in here as quickly as we can, and to get it into people's arms as quickly as we can. So, that's. You heard the same explanation from the federal government that we did, which is that their estimate was wrong. And look, there are a lot of moving parts going on here. And my guess is you're going to see other discrepancies, but they're going to give us the best number they can, and then we're going to go from there. But for planning purposes, we have some general numbers, but I think as far as our team is concerned, until we see those numbers the week before, we're really not going to know exactly what, how to plan. So I think as this gets on further, we hope a couple things happens. We hope it gets a little smoother as far as the estimates. And we also hope that there's more streams flowing into the river. We have 2 streams flowing into the river, and we hope that we get 3 and 4, maybe 5. We have more, more vaccines coming from different companies. And we hope it goes out like this, but we'll take it one day at a time. You had another question.
Yeah, I was wondering about when the data is going to be available for how many people are getting vaccinated.
Yeah, frankly, I thought it was up. It may not be up, but it's ready. It should be ready to go. I don't know any reason it's not yet up, so I'll check on that. But I've looked at it. I've looked at the prototype. I've looked at how it looks, and the data is being collected, and every day around 2:00 that should be coming out.
Next question is from Ben Schwartz at WCPO in Cincinnati.
Hey, Ben.
Hi, Governor. I have a question here from a WCPO viewer, and I'd like to ask the question to Dr. Vanderhoff as well if he's around. But this viewer is wondering, while we're seeing the COVID-19 vaccine rollout, are you able to speak on how the rollout's affecting hospitals and their ability to treat COVID-19 patients? Dr. Vanderhoff, you said earlier that our hospitals are still extremely busy. And so with that being the case, how do you see being vaccinated affecting healthcare workers' ability to work with patients?
Well, thanks. That's a very good question. I think it has the opportunity to impact the hospitals on a number of different levels. First, in terms of the actual work of vaccinating our healthcare workforce, the good news is that our hospitals vaccinate their workforce in large number every year as part of their effort with flu. And they've been involved with that throughout this fall, again this year. So as we conclude our flu vaccinations, the timing of the arrival of COVID-19 vaccines to our hospitals is almost perfect. So I would not anticipate the work of vaccinating the workforce in healthcare to adversely impact our hospitals' ability to deliver on their important mission of caring for the sick. But it's too early for us to expect that the vaccines, which have really just begun, are going to be directly impacting the hospital numbers. Of course, we hope that our strategy of beginning with the most vulnerable patients, the patients who are in long-term care, the people that we've seen, for example, today receiving vaccination, will have a beneficial impact on this curve, on this wave of hospitalizations that we're worried about today. But I want to re-emphasize the message I shared earlier, and that is it's It's much too soon for us to expect vaccines to be bending that curve. It still depends upon you and me to be doing the good work that we began before Thanksgiving, including the various items that I ran through in my earlier comments.
Next question is from Randy Ludlow at the Columbus Dispatch.
Hey, Randy.
Good afternoon, Governor. I wanted to ask a federal advisory panel yesterday put out the recommendations, guidance to the states on who should be vaccinated next. It includes essential workers who can't work remotely, including those in the food chain grocery stores, prison guards, public transit workers, police, firefighters, teachers, daycare employees, those age 75 and older. How does that square with your recommendations and thoughts at this point? When will you formalize who's next in the next phase of vaccination?
Well, I think the recommendation is helpful, certainly should be considered by us and is being considered by us. It's also, Randy, a large group of people. So even if you accepted, perfectly exactly what they said, you would still have to figure out who goes in kind of in what order. So we are looking at that. Again, our focus, is going to remain on saving lives, and the most efficient and quick way that we can do this to save lives, understanding that this is a scarce, at the beginning at least, this vaccine is a scarce resource, and we have to deploy that in as strategically smart way as we can to save lives and to save the most lives that we can. So that's what our focus is going to be on. We spent some time over the weekend working on this. We spent some time again this morning working on this. So we'll try to give people the guidance as soon as we can, as soon as we've kind of taken everything into consideration. But the saving of lives is certainly a major component part of this.
Thank you.
Next question is from Andy Chow at Ohio Public Radio and Television.
Hi, Governor. I'm wondering if you can talk about finding a balance between calling on people to be safe, to practice safe habits, while still respecting religious rights. With Christmas coming up, with Hanukkah just ending, what do you say to people who believe that your call on reducing contact might infringe on their religious freedoms?
Well, that's a good question. Thank you very much. We've made it very clear, and I thank you for giving me a chance to make it clear again. Our orders are not impacting people's religious observance, not impacting their exercise of their First Amendment rights in any way. The only restriction, if you can call it a restriction or caution, in regard to religious services is we've asked people, if they're not the celebrant, if they're don't have a singing or speaking part, to wear a mask. And we just ask them to do that to protect each other. So they are really, any order that we've issued, religious observance have been exempt from that. And that's been from the very beginning all the way through. And we have no intention to change that.
Next question is from Jackie Borchert at the Cincinnati Enquirer.
Good afternoon, Governor. I want to follow up on Farnoosh's vaccine question. How has Operation Warp Speed said that they're going to reserve some of the doses, and that's why the allocation was smaller than estimated. How has that changed your estimates for the rest of the month for both Pfizer and Moderna? And how much notice will you have that more vaccines are coming? Does that make it hard to plan to get them out quickly?
No, I think that some discrepancies are to be expected in an operation this huge. My attitude about things generally is, if I can't change them, let's deal with them. And our job, the way I see it, is to get these out just as quickly as we can in an expeditious manner, and to do it in a safe manner. We have partners. We have the 4 pharmacy companies that are working. We have local health departments throughout the state of Ohio. We have our hospitals. So a lot of moving parts just within the state of Ohio. A lot of things going on. We also now have the National Guard that they will be helping to get some of these vaccines out as well. So really has not changed any plans. We have a pretty steady stream as we see it in regard to the Pfizer vaccine, which is going right now to the congregate care settings, starting off with our skilled nursing facilities where we have the most vulnerable individuals, and then moving through the rest of the congregate care settings. So, we'll take these numbers as they come. We obviously want as many as they'll send to us, and we will use what they send to us. But I believe that it's going to be a steady stream, and I hope it's a stream that will, there'll be more than just the 2 streams. I hope there'll be many streams, or 3 or 4 or 5 streams by the time we're done with other companies.
Next question is from Jeff Reddick at WSYX in Columbus.
Jeff.
Hi, Governor. Good afternoon. You are planning to sign some bills after this at 3:30, obviously a busy time at the State House. Will Senate Bill 175 with the Stand Your Ground gun rights language be part of the list of bills you sign this year? Why or why not?
Well, it's not on the bills that I'm going to take up today. We have a large number of bills that I will be signing today. I will be speaking about this bill specifically, but not today. I've made it very clear, I think, for many times, going back months, that I felt that before the legislature took up other gun bills, that they really should focus on what we have sent them, where we know there are things that will absolutely save lives, protect children, protect families. Legislature can act on these, and they unfortunately did not do so. So I'll have more to say later in the week.
Next question is from Kevin Landers at WBNS in Columbus.
Hello, Governor.
Kevin.
I'd like to get your thoughts on perhaps extending unemployment benefits for Ohioans who've exhausted their 39 weeks of pandemic unemployment assistance. And also, do you think that those who work in nursing homes should be mandated to get the vaccine, considering they're working with the most vulnerable of our population? Thank you.
Yeah, I mean, we're waiting to see what's in the federal bill, and to make sure as far as the additional unemployment. So we'll know more when we see exactly what ends up in this bill. As far as people being mandated to get the vaccine, we've not made that decision. We've made the decision not to do that. I would just hope that anybody who works in a nursing home, who is working with our most vulnerable citizens, would seriously consider being vaccinated. It's a time in your life when you have the ability to save people's lives by one small act. I would really ask you to do that.
Next question is from Spencer Hickey at Hannah News Service.
Thank you. Governor, what role has your administration played in the negotiations around what to do with House Bill 6? And do you have a position on Representative Seitz' most recent proposal?
This is up to the legislature. I think the job of the governor is to outline broad principles, and I have done that. Done that numerous times to the legislature, but the legislature is a separate branch of government. They're working their will. We'll see what they send me. I mean, I've made it clear that my preference is a total repeal and a replace, because I think that when we looked behind the curtain and saw what was how this bill became law, it looked unseemly, and it was unseemly, and it just really kind of stinks up the whole room. And so I think it'd be better off starting over again. So I'll see what they send me. My position has been throughout my legislative career, and now as governor, that if a bill is there and as governor, if I get a bill, and if it improves the status quo, I'm going to sign it. And so, even though I might not get everything that I want if it improves the status quo. So that'll be the criteria that I'll follow.
Next question is from Laura Bischoff at the Dayton Daily News.
Hey, Laura.
Hey, Governor, given the current numbers and trend lines, and the extended holiday celebrations coming up, how confident are you that college students and K-12 kids are going to be able to go back to the classrooms and back on campus in January?
Well, that's a good question. And, I think the schools that have made a decision for example, the K through 12 schools that have made a decision to push back a week, either doing it by being virtual or just not going back for a week. I think that's a smart move. We've left it up to the local school, but there certainly is a possibility when over the holidays that people do in fact get together and that there could be spread, and then that child comes back to the classroom and there can be additional spread. Now, we don't think that, we have pretty good evidence that there's not a lot of spread directly in the classroom, but we also know, and our teachers are doing a great job, and our schools are doing a great job, students are doing a great job. But we know that there's events and things that are kind of peripheral to school where we know we've seen spread. So buying another week is something I think schools should look at, and it certainly makes sense. There's different ways of doing that. But making another week of separation between when they might have been with somebody over that long period of time, Christmas to New Year, and then pushing it out another week, certainly seems to me to be a wise thing to do.
Next question is from Jim Province at the Toledo Blade.
Jim.
Hello, Governor. Thanks again for taking our questions. We've been receiving some calls from some businesses who missed out on the first round of small business grant program. Do you anticipate that there could be another round?
It's possible. What we have to do is study, and we talked about this in our internal call this morning. We need to have asked our budget people, our policy people, to look at what exactly it would appear that the federal government is going to pass. It looks like in that bill is a rollover so that we can take our CARES Act dollars and not have to spend them by the 31st of December, but can roll that money over. So when you look at that, plus you look at what is in this new bill, I think that's going to give us a good idea of how else we can spend, and should spend some of this money. So that's on the table, but certainly no decision has been made. The first priority always has to be to do the tracing, to the contact tracing, to do the testing, and now to do the vaccinations. That has to be at our top of our list of priorities.
Next question is from Laura Hancock at cleveland.com.
Hi, Governor.
Hello.
Three commissioners for the Public Utilities Commission of Ohio have written a letter to you, Lieutenant Governor Husted, and the PUCO, calling for more aggressive action against First Energy, including hiring a third-party investigator to review the company's recent actions, evaluating whether the company should continue to be allowed to do business here in Ohio. They say that the facts have come out as a result of the House Bill 6 investigation. What's your reaction to this letter? And do you plan to push for more aggressive action?
I've not read the letter, so I'll wait until I've had the chance to look at the letter. I've not read the letter, so I will certainly look at that letter. And I think I've made my position pretty clear in regard to that bill, and that bill should be repealed.
Next question is from Jess Harden at mahoningmatters.com.
Hey, Jeff.
Hi, Governor. Thanks for taking my question today. According to the testing page on the ODH website, antigen tests are not included in the number of tests administered or the positivity rate. Given the increased usage of these rapid tests over the last 2 months, I was wondering if the results of these affect the state's overall positivity rate? And at what point the PCR test positivity rate doesn't really reflect the whole picture?
Well, that's an excellent question, and that's something, frankly, we've grappled with and talked about, and it's something I pointed out to our team. And basically, with the exception of maybe 1 or 2 days, as the antigen tests increase, what you'll generally find is that the antigen tests are lower positivity than the PCR test, which would mean if you combine the two, you get a lower number. Now, in the report I get every day, I have that they are broken out. So they're broken out antigen tests, they're broken out PCR tests, and the tables run, and then they are combined. So if that is not being shown on our page, it should be shown that way. What we actually report, when you look at our map, for example, as far as our, what we say our positivity rate is, we have kept it, as you have pointed out, at the PCR level. States are split on this, and doesn't seem to be any particular one way of doing it. So what we have done so far is to give you all the numbers, and then people can make their own judgment. But you're absolutely right. Our positivity that we are reporting is generally lower, maybe 1 point, maybe 2 points. And if you put in the antigen tests, and the antigen tests do continue to go up, and so they play a bigger and a bigger role. And I would say that people say, well, why would PCR be different than antigen tests? There may be reasons, but certainly one reason is it might be a different population. You're seeing the antigen test, for example, used a lot more in nursing homes as part of our protocol. And so you're seeing more and more of that used, and so it may be a different population.
Next question is from Jim Oddie at WHIO in Dayton.
Hey, Jim.
Governor, I want to see if you could take a minute to return to Randy Ludlow's question about phase 2 and the metrics you're going to use to decide who gets to be put in phase 2. Do you start with age, living situation, medical history? Is there a point system? And then secondly, how do you get to notify people? How will the people who are listening or watching today be notified, hey, it's time to go get your vaccination?
Well, you're going to notify them, and other reporters and news media. It will certainly not be any secret once we make that determination. But you're right. There's a lot to balance here, and the overall goal of saving lives is a paramount goal. Age, you mentioned age. Age is a good indicator of your susceptibility. And now we know that we can have a 30-year-old who dies. We know we can have someone who's 45 die. But we also know that above the age of 70, the numbers go up rather dramatically. So you mentioned, each individual situation and their own medical condition. That's going to be very difficult to be that precise. And we're going to try, if we've got, different groups, if you meet a certain criteria, then we know that you would be more at risk. But the other thing, Jim, that we have to balance is we can't make the system so complicated that we don't get the vaccines out, because it is a race against time. And any time that you've got vaccines sitting around is a wasted time when that could be in someone's arm. And anyone can get this and anyone can spread it. So you're balancing precision of trying to target the most vulnerable people, but at the same time, you can't do that so precisely that you slow down the whole process and that you keep vaccine from getting out. And so getting out at a very robust rate is one of the major considerations as well. So these are things that we have, we have to balance and try to figure out, again, with the goal of saving lives.
Governor, next question is the last question for today, and it belongs to Luis Gill of Ohio Latino Television.
Hello, Governor.
Luis.
Thank you so much for doing this, Governor.
Thank you.
This question might be for Dr. Vanderhoff.
Okay.
Hello, Doctor.
Hello.
But Doctor, it's been known through the process since COVID that people that went through the illness of COVID and they got better, and somehow they developed some antibodies, antibodies in their system. Do those people need to be vaccinated, through the process? If they no need to, can those vaccines can be transferred to other people that perhaps need it the most?
Yeah, that's a very, very good question. Thank you for asking it. The recommendation is that vaccines should be offered to people regardless of a history of prior symptomatic or asymptomatic COVID infection. The data from the trials, especially the latter half of those trials, phases 2 and 3, suggested very strongly that vaccination is safe for those individuals and effective. So rather than guess about the duration or the impact of immunity that comes from being infected, we're recommending that everyone consider vaccination for COVID, regardless of prior infection.
Okay, thank you.
Thank you very much. Let me close today with a message of hope. The last few days with the start of the vaccines for essential health care workers and in nursing homes shows that there is hope. There is light coming. Tonight, there's a special light as well, visible to the world in this complexity and strength for the first time in nearly 800 years. Tonight, Saturn and Jupiter, the largest planets in our solar system, will appear 1/10 of a degree apart as they orbit closely to each other. The alignment of these planets produces a great light that is sometimes described as similar to the Christmas star or the Star of Bethlehem, the bright light that led the wise men to the stable and to the baby Jesus. It's also significant that this is happening today, shortest day of the year, the day when we all know that moving forward, the light of each day will get longer. My dad, who was an eternal optimist, always liked this day and always called out this day because he knew that each day going forward, there would be more light, and he liked that a great deal. As we near the end of this year, 2020, I do believe that this is really a magnificent celestial sign of hope and light and wonder and of joy and of what we hope will be a great new year. We must remain patient, but know that the end of this pandemic is nearing. The vaccine is here. We have hope. We have light. We will, in fact, get through this. Country star Gary LaVox is a Columbus native, was the lead singer for the country group Rascal Flatts. Gary has recorded a new song called Christmas Will Be Different This Year. Gary was kind enough to send us a video greeting about it, and I would like to play it and some of the song. Eric?
Hey, Columbus, Ohio, the great state of Ohio. It's Gary LaVox, and just wanted to tell you I got a brand new Christmas song out this year featuring Stefan Macchio, and it's called Christmas Will Be Different This Year. And, we kind of wrote the song about just all of the things going on in 2020 and just how crazy this year has been. And Christmas will be different for a lot of people this year, not just with COVID, but, kids being doing online schooling and everything else. So everything that we knew as normal is not anymore. But, the only thing that we can do is, as Buckeyes, is stay safe, wear a mask, try to put the other people first. And, but check out my Christmas song, Christmas Will Be Different This Year. Everybody in the Buckeye State, y'all stay safe. Have a great Christmas and a safe, healthy holiday season. And go Bucks.
'cause I won't be there and you won't be here. But I look for the magic anyway. Now keep all our traditions just the same, even though Christmas will be different this year. Yeah, but I won't be there and you won't be here. Oh, Christmas will be different this year. Oh, Christmas will be different this year.
Well, we want to thank Gary for that. That was lovely. Hope everybody has a